Okay, hi everyone, and welcome to our webinar today with the Clinician Engineer Hub, bridging the gap between medicine and engineering. It's always great to have these continuous webinars, and today I'm very excited to introduce Diane Ghanem from the American University of Beirut, qualified MD, currently based at the Johns Hopkins Hospital in the US, where she is actively practicing in orthopedic surgery and also undertaking research in that field as well. And today we're going to be learning a lot about ChatGPT and the value of that in terms of the engineering space, particularly related to orthopedics. So Diane, welcome and over to you.
Thanks, Neil. Thanks so much for having me. It's a pleasure to be able to contribute to the hub and also to be presenting today with you guys. Okay, can you see my screen?
Perfect. Yeah, can see it. Thank you.
Perfect. So I'm going to do a brief introduction about ChatGPT and a couple of research projects that we've worked on here at Hopkins. We have a couple of topics, but each one of them adds something new to the literature, and that's kind of what we want to touch on today. So, of course, this is my introduction. So basically, ChatGPT is an AI large language model that has recently been used in medical education and in clinical decision making and post-operative care. So it has shown to be very beneficial in all three of these. People have published about it and it works. So it has an unprecedented ability to generate accurate and reliable responses for questions related to these topics. Yet, what we haven't spoken about so far are artificial hallucinations. So, is what ChatGPT saying always correct? And what should we be worried about? So, the purpose of this specific study was to examine the ability of ChatGPT 4 to provide accurate and scientific references supporting the well-established airway, breathing, circulation, disability, exposure approach, so the ABCDE approach to the trauma protocol. So what we did is we asked ChatGPT in November 2023, what is the ABCDE trauma protocol? It generated a couple of answers and grouped them under the 5 ABCDE subsections. And then we asked again, and we said, please provide PubMed indexed references to support each of the 5 steps mentioned above. So we repeated that process 6 times for each one of them to end up with 30 ChatGPT references. We had 2 independent reviewers look at those references, and we used a standardized grading system that has been previously used in the literature. The scoring system goes from 0 to 2, where 0 is for a non-existent reference, 1 is an inaccurate reference providing false or incomplete information that would require modification, and 2 is an accurate reference requiring no modification whatsoever. So here's an example. In that very first reference, we can see that the ChatGPT reference has nothing to do with the PubMed reference. This being said, if we were to take any of the components of that reference, we would be unable to find it online, whether it's on Google, PubMed, Cochrane, Embase, Scopus. So we tried all of these and we were unable to find it. So this one ends up with a score of 0. That second one has the wrong authors, the wrong date, and the wrong PubMed ID. So it's considered inaccurate, requiring modifications. And that very last one is a perfect reference because it's exactly as the PubMed one. It's 100% correct, so it takes a score of 2/2 and is considered accurate. So after doing that kind of categorization, we wanted to see the agreement between both of our reviewers, and we had excellent agreement between the two. And then we looked at the ChatGPT overall performance using the mean score of those 2 independent evaluators. And the results were surprising because we ended up with a mean score going from 1 for disability or neurological status to 1.67 for circulation, for a total performance of 66.7% only. Now, there was no difference in the ChatGPT performance between each of the 5 categories. So that is our p-value that is non-significant there. So when we look at that 67%, we want to know how many of these references were true and how many were false. So the true would be considered the accurate ones, the ones that were perfect and scored a 2/2. So we ended up only with 13 out of the 30 as being accurate. So that is merely 43%. And 57% were false. 13 were inaccurate, requiring modifications and scoring a 1. And 4 of them were actually completely non-existent. So this was the first study to assess the accuracy of ChatGPT generated references in orthopedic surgery. We had 30 ChatGPT generated references associated with the ABCDE trauma protocol, and ChatGPT 4's overall reference accuracy was only a 67%. So 57 of the references provided for this approach were inaccurate or non-existent and considered false, which is very much alarming because at the end of the day, while ChatGPT knows its ABCDE, it cannot cite its source.
Fantastic. No, that's very useful insights, particularly with a research perspective into ChatGPT, because I certainly know that it's an area that we're constantly learning about and reading about, but to do a research element into it is really beneficial. I have a couple of questions actually, if I may, Dan.
Absolutely.
So, I'm no academic expert in ChatGPT, certainly not, but clearly we're not quite there yet. And why do you think that is? Is it to do with the algorithm? Does it need further modification, optimization? What do you think needs to change in the ChatGPT space going forward just to improve accuracy and such like?
Yeah, I think this is an excellent question because this is exactly where people are at right now. So actually, if we look at different versions of ChatGPT, we have a bunch of errors with ChatGPT 3, 3.5, and then 4.0 that keeps on being updated and becomes better and better, literally within months. Like it's super fast. The results of studies are changing by the
Mhm.
minute. So they're definitely already improving that. I think one of the most important things for us is that initially we should not forget that ChatGPT was not built for the medical field, yet we
Sure.
are
Yeah.
starting to use it for it. So this is kind of where the fine line is, because while we do want to meet the audience, and this is why we do work on research about ChatGPT in medicine, we kind of don't want to encourage that either just yet because it wasn't built for that. So we're kind of
Mhm.
judging it for something that it never said it was intended on doing.
I get it, yeah. And also actually you just raised a very interesting point because I noticed on the slides the sort of version that you were using for ChatGPT. So it seems that constant versions are updating themselves. If I may ask, do you know any stark differences between the versions, or what was the reason for the choice of the version in this particular project?
Right, absolutely. So there are multiple versions and currently available. So basically, you have the option now, if you log into ChatGPT, to select which version you want to work with. Now, some of them are free and accessible, and some of them
Mhm.
are paid. This being said, if I'm looking at the performance of ChatGPT, I want ChatGPT to be on its best behavior. So in that
Yeah.
case, I would pick the ChatGPT 4, like the most advanced one. But then if I'm looking, for example, at patient education, and we will see that, we will discuss this in a bit, but basically if I'm talking about patient education, not all my patients have paid for ChatGPT. So
Of
now
course. Yeah.
if I'm doing a patient education project and I'm actually assessing ChatGPT 4, I am I'm overestimating the performance of ChatGPT education to my patients because they're not using the same exact model. So I think this is
Awesome.
very important, the accessibility, the way it's free. And then in addition to that, let's say you do have access to all, the performance, the accuracy, the precision but the conversational manner of it and the structure of it changes. So ChatGPT 4 gives you bullet points, it gives you bolded, italics, it creates a nice table for you. It is more critical, more contextual, more nuanced than ChatGPT 3.5.
Fantastic. No, that's a very useful explanation, actually.
So this project just got published in JVJS Open Access in the critical
Oh,
issue
congratulations.
education.
Good.
So I'll move to the next one. Educating patients on osteoporosis and bone health, can ChatGPT provide high quality content? So again, now we know that there's a widespread interest in AI, but specifically an AI language model, ChatGPT, which was developed by OpenAI in California, uses 175 billion parameters with an extensive database and a neural network architecture to be able to provide sophisticated responses and conversational style. And this is kind of the hallmark of ChatGPT and why it's become so popular as a large language model. So the aim of the study was to examine ChatGPT's ability to provide accurate and evidence-based, patient-centered recommendations for frequently asked questions about bone health and osteoporosis. So first, we looked at the web. We identified the most commonly used websites for osteoporosis on Google. We selected 11 highly frequented and reputable websites. And so the reason for doing that as such was, again, to kind of mimic what our patients would do. Because if a patient is looking for something about his health, he's not going to go to page 2 or 3. He's going to Google it, look at the first page of Google, and probably read a couple of links that appear on that page. So we picked the first 11 that were highly frequented and reputable, and then we reviewed all of them. We ended up with a total of 108 questions. A lot of them were very redundant, and some were deemed more important than others by our orthopedic surgeons at Hopkins. So then we selected 20 frequently asked questions. We made sure that they were evenly distributed among 4 categories, being diagnosis, diagnostic methods, risk factors, treatment, and prevention. And then we decided to enter those questions into 20 separate ChatGPT chats, and we recorded the responses generated by ChatGPT. We repeated that process 3 times just to ensure for the homogeneity of the responses and to grade accordingly. So we ended up with 60 responses generated. They were reviewed by 4 bone health experts who were blinded to that study. We had 3 orthopedic trauma surgeons and 1 bone health center manager. They did an independent evaluation, and they were asked to score the responses again on a standardized scoring system, looking at response accuracy score going from 0 to 4, 0 harmful response, 4 excellent response, not requiring any clarification. So the independent evaluators gave a score. The average accuracy score calculated for each question was used, and we ended up comparing the mean scores across the 4 categories. Overall performance of ChatGPT 3.5 turned out to be a 91%, with most of the questions deemed to be accurate, requiring minimal clarification and getting a score of 3, or excellent responses not requiring any clarification. So the overall score over 4 was more often than not in that range, 3 to 4, with the mean of 3.64. So if we look a little bit closer to our questions here, the 20 questions, 2 were actually considered excellent and received a full score. They did not require any clarification. They were clear. They were structured. So these questions were, what is osteoporosis? And do previous fractures predict future fractures? Now, receiving a score of 3 and deemed accurate but requiring minimal clarification, we had the 18 other questions. They were scored between 3.25 and 3.92. An example of questions would be, how is osteoporosis diagnosed? So none of the questions received a score of 0 or 1. So none of them was deemed harmful or inaccurate, requiring substantial clarification. Now, only 2 questions were graded as a 2 by only one of the 4 experts. So the average accuracy resulted in a 3+ mean accuracy for those questions, and hence the question ended up being graded as accurate. Again, between the 4 categories, there was no statistical significance. So the limitation of this study are ChatGPT related. So ChatGPT does not, at the time of that study, did not have updates beyond January 2022. Today, ChatGPT doesn't have updates beyond January 2024. It has limited access to academic journals. Why? Because while now it does have access to the internet, academic journals that are not open access need a subscription. So ChatGPT is missing out on that part of the information. And then again, we are aware that our response criteria are subjective. So if other people decide to have another standardized system for the evaluation, they may end up with different scores. So overall, ChatGPT 3.5 achieved a 91% accuracy for the osteoporosis frequently asked questions. The responses were clear, comprehensive, and very well structured, and it demonstrated a high degree of accuracy, aligning closely with expert opinion and literature, which makes it a promising complementary educational tool. Thank you, Neil.
Nice. Yeah, this study is very interesting, and it's got me motivated to do studies of my own. Um, so that brings me to one main question, if I may.
Right.
How do you actually go about then designing such a study? Because obviously there's the ChatGPT element, but I gather in this particular talk, a lot has gone on in the background to design the study part. So any hints and tips, anything that novices like myself, if I wanted to go and use ChatGPT in a GI sense, what are the things that I need to think about with the study design?
Right. Absolutely. I think this is the question that a lot of people don't ask. They forget to ask this question. They hop on a research project about ChatGPT because it's exciting, it's what's
Yeah.
new, and they
Mm.
send it for publication thinking, oh, it's going to get accepted because it's ChatGPT, and it gets rejected.
Oh, wow. Okay.
And the reason for that is exactly that they don't ask those questions that you just asked, which is, again, if I'm looking at the patients, it's how is my patient behaving? So I need to answer that. If I'm talking about orthopedic surgeons at Hopkins, I'm using ChatGPT 4, I'm accessing academic journals, I'm doing these things. So I think a lot of the times it's about what am I looking at and how can I mimic real life the closest possible, because it's only then that it's actually answering the question while being clinically relevant. I think it's the
Mhm.
clinical relevance that people usually miss out on. Another indicator of that is if we go back to the number of iterations that we had, we ended up
Yes.
with 60
Mm.
responses. And the
I like
reason
that.
we did that is because ChatGPT tries to give you unique answers each time.
Mm.
Meaning, if I was now to put a question into it and you put the same exact one, while the gist of it is going to be the same answer, what the way he's going to answer to you is going to be different to me. To like the wording is going to be different. There are differences that are going to be there, although probably insignificant. So what we had is we had each of the evaluators evaluate the 3 different sets of answers for each question to avoid that, to kind of have a mean of the responses because of that variation that it has. So I think patient population, grading system, and then having a granular scoring system and explaining what it is and what it should be specific to our field is quite important. In that case, am I harming my patient? Like, is it important for me to know if it's true or false? Not really. So I'm not doing it like the reference accuracy. I'm doing it in terms of the accuracy of a response to my patient. Am I harming my patient? Am I misleading my patient? Or
Mhm.
am I actually informing him in an excellent way? And I think these are kind of tweaks that people fail to see.
No, definitely. And I think, everything that we should do, certainly in the medical space, should always have the patient as the focus. And I think sometimes in academia, we like to do studies and we wonder how does that actually impact the patient going forward. So that actually brings me to then a question just to clarify. You may have said this. Were patients involved in the study design at all, or in this particular case, was it not sort of needed or?
Yeah. I think th this is a nice idea actually. Like it could have been included in the sense that we could pilot it perhaps on patients and make it even more relevant. But in our case, it wasn't needed, and the way we substituted that was with our web search.
Yes.
So we kind of decided to mimic it. We assumed that the frequently asked questions were already probably in the past piloted on a couple of patients. They emanate from the fact that these are questions frequently asked by patients. So we picked these and we took whatever was relevant. And
Yeah.
this being said, we didn't take just any 20. We actually took 108 and then
Mhm.
picked the 20. So I think this kind of
Very
spared
rigorous. Yeah.
us using patients, but piloting on patients would also be very valuable, if not even more valuable.
Definitely. And do you think, I mean, I may have to try this, but could you actually ask ChatGPT how to design a ChatGPT study? Or
Absolutely.
I'm
We absolutely
gonna
can.
have to do that and see what the
Exactly.
outcome is. But
You
yeah, no,
absolutely,
very interesting. Very, very interesting. Thank you so much, Dan.
absolutely. Another thing we say about ChatGPT too is actually that, for example, it will, if well used, it's really good. And specifically for research, we don't want to have plagiarism, right? So like now a lot of papers tell you if you've used ChatGPT, you have to disclose it, you have to acknowledge it, and stuff like that. But actually used in a smart way, ethically, and without doing any plagiarism, would be in the very early stages when you're brainstorming. Instead of picking your friend's brain, just pick ChatGPT's brain. Ask ChatGPT a couple things. This works well, and the way we say it is it spares you the blank page syndrome. It gives you something to work with.
Yes, yes, makes sense.
So I would definitely encourage that. Now,
This looks like a really exciting topic. Yeah.
now we look at the performance even more. And again, now we're talking about, earning the board certification in hand surgery. So kind of the level of a physician. So we want ChatGPT on its best behavior. So this is a study where I would be using ChatGPT 4. So again, standardized exams, they are key elements in evaluating the academic competencies. They're a reference for intellectual acumen across demographic groups. AI language model ChatGPT has an extensive knowledge base, and it would be interesting to see how it would perform on such a test. And why is that? Because originally, a couple people already demonstrated that ChatGPT has the potential of passing the USMLE Step 1, Step 2, and Step 3 exams. And it passes well. It scores around the average and it passes. And then a couple people, when it came to the orthopedic in training examination, found that it performed at a level of a fifth PGY5, so fifth year resident, which is kind of a chief resident, a senior resident, whereas us at Hopkins doing it in a similar but different way and using ChatGPT 4, we're able to see that it performs at the level of a third year orthopedic resident. At the same time that we published this, a couple of people in France, in Strasbourg, ended up publishing about ChatGPT's inability to pass the European Board of Hand Surgery diploma exam. So this this begs the question of where does it leave us? Is it only passing American exams, or is it just not passing subspecialized exams? Is it just so hard? So what's the threshold where ChatGPT is just unable to perform or to pass well? So the aim of the study was to evaluate if ChatGPT can pass the American Society for Surgery of the Hand certification exam, a highly specialized medical competency test. So we went to the ChatGPT for testing. We chose the self-assessment 2019. The reason for choosing the 2019 was that, again, the ChatGPT doesn't have updated data past 2022. So we wanted to make sure that we are judging it based on its competencies at that time. We wanted to avoid the underperformance. So we picked 200 questions. The questions, just like the European exam, went from basic sciences, bones and joints, nerves, muscles and tendons, wound management, vascular, rehab, and miscellaneous. And then we moved on to copy pasting these questions, including the media, so figures, tables, images, and all the multiple choice options into ChatGPT. Each question was done in a separate chat, and we excluded the video-based questions because ChatGPT cannot process that. And back then, it couldn't process more than 4 images at once. So again, if a question had more than 4 images, we excluded it. All ChatGPT answers were recorded in an Excel sheet. We looked at the percent correct. We compared the media questions versus the no media questions using a Pearson chi-square. And we looked at the actual self-assessment report provided by the ASSH 2019 to compare the performance of ChatGPT with that of the 322 hand surgeons who had taken that self-assessment 2019. So when we look at the performance of ChatGPT 4, it ended up with a 62% performance. That is very much a passing grade. On the questions without media, we ended up with a 66%, and the one with media slightly lower, and that is a 56%. However, there was no statistical significance between those two groups. When we would compare it to the surgeons, we see that the surgeons are well above ChatGPT 4's performance. ChatGPT 4's performance was below the average. The lowest score for ChatGPT was in bone and joints, where it scored a 49% versus a 76% for the surgeons. And the highest score was in vascular, where you had 82% for ChatGPT, but only 68% for the hand surgeons. So this is the first study to evaluate the performance of ChatGPT 4 on an American board exam of orthopedic subspecialty. With an overall score of 62%, it scored below the average of hand surgeon, but it is still a remarkable performance, or so we like to think.
Yeah.
So because we would like to think, like, where does this difference come from, right? So why is there a difference between the European performance and the American performance? And so when I asked myself this question, I looked into it, and actually ChatGPT itself was developed by OpenAI, which was a concept done in the United States of America. It is optimized, whether we like it or not, for American standards. So even if it's able to answer in French and Spanish, whatever, it is actually optimized to the American standards and the American standards of doing things, even in medicine. Now, in terms of limitations, again, it's a new image processing ability that we have with ChatGPT. We cannot judge it by what it's not meant to do. ChatGPT is a large language model. It is not an image model, yet it currently gives us that ability. So this is still new, but it's on the right track. There is no training in radiograph interpretation. Again, as we mentioned before, there are no updates past January 2022. So it's included up until December 2021. And at the end of the day, whether we like it or not, the complexity of human cognition and the context understanding can, till today, cannot be replaced.
Mhm.
So a remarkable performance, I'm not so sure, but maybe a promising performance. A
Nice.
promising performance where it can be a valuable learning tool and above all, a complement rather than a replacement for the training of orthopedic surgeons.
Great conclusion. Yeah, I mean, this is definitely something in the medical space that we are seeing a lot of. I've been involved in assessment generally for well over 20 years, so I'm seeing constantly how it's changing.
Right.
And one example, certainly in the university space, is I'm hearing about, and I'm convinced that students are using ChatGPT particularly to answer essay questions. And so, you provide an assignment and then they'll put that into ChatGPT and something quite remarkable comes out. In terms of this sense, I agree also that that limitation that you mentioned is very, very valuable and important to, just keep remembering that the human mind and the sort of artificial mind is very different. So we have the skill set of emotion and cognition, which I think the computers don't have yet. But then I'm wondering, are they going to go in that space, which could prove interesting? What do you think then, Dan, based on this, if I may ask, with ChatGPT and the way computers are able to potentially outperform doctors, not all the time now, but we are seeing it. Do you think that will change the way assessment is done, or what do you feel? Do you think the current assessments generally should focus more on the cognition side, the sort of the way that the human mind processes? What do you feel?
Absolutely. Absolutely. And I love the way you asked that because I was asked this question a little differently in Paris a couple of weeks ago when I presented this. And they asked me, so what's next? What do you think is next for ChatGPT? And I said, I think the more interesting part of the study is not ChatGPT related, it's us related. It's about the medical system and the standardized exam, because at the end of the day, we are seeing that ChatGPT is able to pass a test and well, and maybe even outperform us, but we know for a fact that it wouldn't be a good surgeon. So, what kind of surgeons do we want? Do we really want someone who can pass exams? Or do we want that holistic person who has the cognition and the emotional intelligence to be there for their patients and care for them rather than just attend to their questions, which they can always do? Because at the end of the day, the information is always there. We can find it, we can look for it, even if it's not instantly. But the humanity of it and the personal touch, I don't think it's something that we will ever have, and I think that ChatGPT will ever have. And
Mhm.
I think we will never run out of jobs just for that.
Yeah, no, I agree with you. I think certainly the way we were assessed traditionally, I'm not sure the value is there. So, ticking boxes in an MCQ, basically you've kind of just memorized some knowledge from a book or online. And I think, like exactly you say, if you don't know something, we just look it up. It's the norm now on ward rounds or in clinic. Um, so I do think the assessment space and how we move forward will prove very interesting. I don't know much about, say, the USMLE, but I have read that the way they are scoring that has changed. So potentially, maybe the nature of the assessment will change as well. But let's see. Let's see what the assessment bodies are doing behind closed doors here.
Absolutely. And this has also just been published in the Hand Surgery and Rehabilitation.
Congratulations.
And so this very last one is very interesting. Um, this is how to use ChatGPT for our own benefit right now. So we spoke about, what to beware of and the warnings of where is it getting its references, specifically in a field like the medical field, where it's so important to be accurate and to have the right backup for it, so the right sources. And then we discussed about its ability to educate patients and to be really good at it with a 90% performance overall. And then we just looked at how it's able to pass the surgery exams. So by now we know that it's good to educate patients. It's probably good to educate residents and to help them study. Where else and how else can we use it? So optimizing the readability of orthopedic trauma patient education materials using ChatGPT 4. As I just mentioned, the online education materials for patients are now a fundamental resource to provide patients with high quality information. They are widely available and they are recommended. So when patients have a question, they go online to seek an answer. However, most research has shown that these patient materials are at a high reading level, way above the grade level that they are able to comprehend. So we recently looked at the Orthopaedic Trauma Association patient education tool at Hopkins, and we saw that they were well above the recommended 6th grade level and maybe too difficult for patient comprehension. We then looked at the Journal of the AOS, another big journal, and we compared their patient education materials to those of the Orthopaedic Trauma Association and saw that after almost a decade, the readability remains unchanged and remains too difficult. So this pushed us to look for a solution. And we said, okay, ChatGPT has been doing well and has been performing really well in other parts of our orthopedic surgery subsections in terms of patient education. Can it help with this? So the goal was to evaluate the ability of ChatGPT to rewrite these orthopedic trauma patient education materials to a recommended 6th grade reading level. We accessed the articles online. We had 41 OTA articles accessed in December 2022, 46 AOS articles in March 2023. We looked at those articles, we copied and pasted them into Microsoft Word document. We made sure that everything that was like bullet points, bolded, author information, hyperlinks, things that were not relevant to the actual education of patients were removed. And once these were removed, we selected the text and used the calculators on Microsoft Word to look for the FKGL, which is the Flesch-Kincaid grade level, and the FRE, which is the reading ease. So the FRE is a score that goes from 0 to 100. And ideally, this being the reading ease, we would want this to be as high as possible. So we would want this to be 80 plus. That means it's very easy to interpret. Now, a high FRE means a high reading ease should be associated with a low FKGL, so with a low grade level. The easier it is to read it, the lower my class level, and the easier the interpretation. The recommendation given by the CDC and the AMA is a 6th grade level. So easy interpretation, 6th grade, FRE above 80. So we generated the articles using ChatGPT. We explained exactly what the FKGL is, and we said it's based on factors like sentence length and word complexity. Please rewrite the text I send you at the 6th grade reading level, FKGL between 6 and 7. When we did that, we calculated again the FKGL and FRE of those newly generated ChatGPT articles. We reviewed these articles and we also reviewed their titles, and we graded them as being accurate, refinable, or insufficient. So we also used statistical analysis to compare the FKGL between the original articles and the ChatGPT articles, and the same for the FRE. Looking at the OTA articles, we see a significant reduction in the Flesch-Kincaid grade level, with the grade going from an 8th grade level to a 5th grade level. So we see here a drop in the graph from the gray to the blue. and then a significant increase in the reading ease going from a 65 to a 76, again with an increase from gray to blue on the graph. Looking at the AAOS articles, we had a significant reduction in the grade level from an almost ninth grade level to a fifth grade level, and a significant increase in the reading ease from a 57 to a 76. Looking at the titles of those articles, we saw that only 39% required a revision and 61% did not. Looking at the content of the articles, we saw that most of them were accurate and only a couple were insufficient and refinable. If I remember correctly, more than 70% were deemed accurate. So, in conclusion, there was improved readability of the orthopedic trauma educational materials done by ChatGPT 4. It was able to rewrite the articles to get them to a fifth grade level, well below sixth grade one, and no modifications were needed for 71% of our articles. So, ChatGPT 4 could be a new, simple, and effective tool that allows to optimize with expert review the readability of patient education material. And this was just submitted for publications to JOT right now.
Great. A lot of hard work has gone into this study for sure. Yeah. I do actually have probably more of a broader question. Um, I guess when you submit these sort of studies, is there specific journals that you aim for? So is there in the journal space ones that are now you would recommend for ChatGPT specific studies, or I gather you've also published in sort of orthopedic related journals as well. Any advice for people that then go on to do studies? Where do you think the sort of best chance lies in getting a successful publication?
Right. This is a great question. I was actually just debating these with with friends in France who wanted to publish a new study about also ChatGPT, and they, for example, are looking at JMIR, which is a journal of medical intelligence, artificial intelligence, and stuff like that. So there are
Hmm.
journals for this. At the end of the day, it goes back to what do you want to achieve with this? And where do you want your expertise to go? I
Hmm.
personally wanted to make sure that my topics, although very much probably applicable to another field, I could have done this study with anything else. I
Hmm.
made sure to pick an ortho related topic so I could submit it to an ortho journal because my goal was to kind of drive an expertise in it within orthopedic surgery. But I could very much do it anywhere else. I have a bunch of friends who also did that for, let's say, cardiology, gastroenterology, and use
Hmm.
their specific journals. So again, specialty journals. But otherwise, a lot of people are going just to AI journals for like medical innovation and
Yeah.
research and stuff like that. And I feel, to be completely honest, that it's easier to get accepted in those other journals because
Hmm.
it's specific to the topic. So you're already spot on. And they kind of want to be the hub of all that research. In
Sure.
ortho, unless you have the best study that talks about this and it's well done and it's saying something new, you're not going to get it in. But for me, I enjoy that challenge and I enjoy also keeping the expertise within the specialty because my goal is kind of to see to what extent can I push it in a
Hmm.
surgical specialty and how much can we innovate in those regards. So I think it's also like a personal mission kind of thing, but
Yeah.
there are a lot of journals about it specifically.
Well, you're clearly, Dan, very passionate and orthopedic surgery is a tough area. So to do that and to also do, the engineering innovation on the side, I mean, it's very impressive. I was actually just thinking now, I mean, I don't know the literature on this, but has anyone tried to ask ChatGPT how to do, a particular operation in orthopedics? Does it actually say, well, you should do one, two, three, four? Because that would be quite interesting if it's skilled that way.
Yeah,
Um,
exactly. And they've done it. they've
Oh,
done.
okay, fine. All
And
right.
it did pretty well as well. And another smart thing that they've done, they've asked it to do the paperwork for them. So the discharge summaries, it
Hmm.
asked ChatGPT to do discharge summaries, and it did pretty well as well. But it's interesting to see how it can help us rather than, enslave us or be used for the wrong purpose.
And I think, any doctor despises the discharge summary. I mean, I don't know, but it's something that we don't want to spend too much time on, and particularly the administration. Fantastic.
Absolutely.
Well, thanks so much for your time, Dan. I mean, just to get you on the call live from the US, we really appreciate and look forward to, further work from you and all the great publications and presentations.
Of
Thanks so
course.
much.
Thanks so much, Neil. Thanks for having me. I really enjoyed this.
Yeah, no, I did as well. Absolutely. Okay, take care. Bye bye.